What's up, beautiful people? Another day, another study. And there's a lot to cover, so I'm going to try to be quick. I have more of the data down below, but everyone's talking about the obesity rate now being nearly 70%. And where did that come from? Well, it was from this study where they took the newly proposed Lancet definition for obesity, which adds in different markers. So what we call anthropometric markers. I actually use these all the time. This study looked at waist circumference, waist to height ratio, waist to hip ratio. I use waist circumference, waist to height ratio, and something called the body roundness index. We've done videos on that before. So the new criteria are elevated BMI plus one elevated anthropometric marker or a BMI greater than 40, or two elevated anthropometric markers, or three excess body fat on a DEXA or similar modality. So when they applied the new criteria, 68.6% of people met the obesity definition. Now, what I think is interesting is that of people who had a normal BMI, 22.3% of them met the anthropometric only obesity criteria. What this is saying is these people, despite having a normal BMI, had elevated abdominal obesity, elevated visceral fat. We know that that's a risk factor for cardiovascular disease and other health problems. Now, in the longitudinal analysis, BMI plus anthropometric obesity had the highest rate of diabetes, cardiovascular disease, and all-cause mortality compared to people who did not have obesity. Anthropometric obesity only had higher risk of cardiovascular disease, diabetes, and all-cause mortality, but not as much as the anthropometric plus BMI. So a lot of people are claiming we need to throw BMI out. BMI is worthless. However, it's another marker. So this is saying that if people who have elevated BMI and elevated anthropometric obesity markers, that globally there's too much excess body fat. It's not just concentrated in the abdominal area. And these people are the highest risk. So therefore, measuring BMI and these anthropometric markers, which is exactly what I do in clinical practice, gives us the most information about what's going on and risk stratifying people, which is exactly what I do. I'm a fiend about that. I create a spreadsheet that's available for free for people to know what these risk markers are. So I don't think we should just throw BMI out. I don't think BMI is worthless. Adding it to other tools appears to be, based upon this study, gives us the best marker for a lot of these things that we care about: cardiovascular disease, all-cause mortality, and diabetes.